Welcome, my Phoenix family, to One-Footed Phoenix. If you're a patient with chronic pain, or if you know a loved one with chronic pain, you've probably heard about the opioid crisis. What you may not know is that the alternative to opioids is actually may or may not be safer than taking opioid prescription drugs to treat conditions like chronic pain. Regular usage of medical cannabis can have some pretty negative side effects and some pretty crazy risks that you definitely should be aware of before choosing to proceed with this treatment. While this treatment didn't work for me, and while I will be highlighting my experiences in this video, that doesn't mean that it won't work for you, but that you definitely should be aware of the risks that are out there. So let's address the big question in the room. Why would someone like me need strong opioid medications or need to be prescribed something like medical cannabis? Well, let me back up a little bit. CRPS, otherwise known as complex regional pain syndrome, is pretty much the most painful condition known to man right now. CRPS is a rare condition where your nerves basically have PTSD and they just feel like they're getting injured and hurt over and over and over again. The condition comes with a myriad of symptoms ranging from discoloration of the limb or the affected area to spreading through the body to sensitivity to touch, just like extreme sensitivity. So like anytime anything touches you, even just air blowing against an affected limb or an affected area with CRPS can be extremely and excruciatingly painful. Also, on the McGill pain scale, CRPS is rated above childbirth and kidney stones. So when I say it's really painful, I'm not kidding. You might be asking, okay, so you amputated your leg so that you didn't have CRPS anymore. So doesn't that mean that the CRPS is just gone? Well, no. Actually, it doesn't. You see, yes, well, the pain got better from the CRPS when I amputated my leg. There are still some residual effects in my remaining limb, or in my nubbin, as I like to affectionately call it. And these side effects of the CRPS still require me to take medications for phantom limb pain. Now, phantom limb pain, yes, it's completely different from CRPS, but my CRPS symptoms are what cause me to have a lot more phantom limb pain than most amputees. Phantom limb pain, again, is a nerve disorder. It's a disruption of the nerves where the nerves have signals that start in the brain. So that signal starts up here in the head, and it goes travels down the spine, goes and tries to find the foot, and then that signal freaks the heck out of the brain, saying, "There's no foot there. What the heck? Like, this is not okay. Like I'm dying," basically. And phantom limb pain is much like having a broken fire alarm that you have no idea how to turn off. So those pain signals can still be very, very real and very, very painful, even though the limb is currently not even present. If you're interested in my past videos about medical gaslighting, I would definitely check those out down in the links below after you're done watching this video. Medical gaslighting is something that I definitely experienced through my experience with chronic pain, and it's definitely really frustrating when you're just trying to get a doctor to listen to you of like, I am in pain and you do not understand how bad this pain is. So let's move on to some of the potential side effects of using medical cannabis. Some of these are short-term effects and some of them are long-term effects that are kind of scary. One of the most notable side effects that I actually did do some research on before I ended up taking medical cannabis is the fact that if you inhale medical cannabis oils or, just cannabis, if you smoke that or if you inhale it, doesn't really matter if it's a vape or a smoke, like in a cigar, it really doesn't matter. If you breathe it at all, this inhalation of the cannabis can cause things like lung cancer, it can cause breathing problems, it can cause bronchitis. For me personally, I didn't feel like breathing cannabis was going to be a smart idea, so I never actually went through that delivery method for medical cannabis. However, I know some people that do, and yeah, it's a little scary what can actually happen. Medical cannabis has been linked to a lot of studies studying memory loss and concentration loss. It also can be linked to someone having more difficulty learning new things, which, as a young person, that's definitely not something I want to have to deal with. But also, this study that I read online that had been done in with people from America and from, I think it might have even been an FDA source. But anyway, this study that I was reading, it said young people are even more susceptible to having these kinds of problems from taking medical cannabis. So if you have a brain that is still developing, aka you're not yet 25, it actually can be even more of a risk for you to be taking medical cannabis. That is something I did not know before I started taking it. Something that also wasn't really explained to me before I started taking medical cannabis or before I got my cannabis card is that in some cases, medical cannabis can actually make conditions for mental health a lot worse. And it can also make them show up if they've never previously showed up. Those risks get even higher if you have a past history of anxiety, depression, or schizophrenia. There is also a risk of developing a somewhat permanent high heart rate. Some people say that you can't get addicted to medical cannabis, but actually there are studies that say you absolutely can get addicted. And there's also something that can happen if you overuse it. It can cause severe nausea and vomiting, which can become chronic with chronic use of cannabis. That's not something I really want to experience. This is interesting. Something that I have read about medical cannabis is that it can increase your risks of abusing other substances. So it could increase your risk of becoming addicted to the medical marijuana, but also it can increase your risk of becoming addicted to other things that are used to help treat pain. There are also risks of developing hallucinations, especially if you take too much cannabis at a time. There's the risk of developing paranoia or mood swings or mood shifts. And in some cases, there's also the risks of developing psychotic episodes where you just become aggressive. For me, just this feeling of being like high and like goofy all the time, I guess, where it just, I don't know, I felt like I was always like saying weird things or like doing weird things, and I just constantly felt high, and it was not a very good time, honestly. If you would like to see another One-Footed Phoenix video, click over here, and I'll see you all in the next video. Thanks for watching! Bye!